Once again. Okay, so welcome to the Parallel University. Okay, this webinar platform. Once again, I welcome Dr. Devak Chudasma. Okay, so he is going to handle all the section. So at the end of the section, the students can raise their questions. So he will be available. Okay, so I hand over to Dr. Chudasma. Now, right now, you can start.
Thank you so much, sir. Uh, Again, thank you, Dr. Ravi, my guide for my PhD in public health, and thank you, Parul University, this opportunity where I can uh, give my opinion and which I love the most topic, the subject, the diabetes. And that's why I have chosen this topic because I'm very much passionate about how we can prevent not only the diabetes but all the communicable disease. And I hope this presentation will help to all of you to bring down the incidence and prevalence in our country, even the globe, and maybe some few steps toward primordial prevention of diabetes and all non-communicable disease. So again, I thank you, our university, and my guide, Dr. Ravi, as well. So I start my presentation. Is it visible?
Yes,
Hello?
yes, yes, yes,
Okay.
yeah, it's
Okay.
good.
So today my initiative is to how we can free India from diabetes or other communicable disease. And diabetes free India, which means children born after 2030 or 2040 should not develop diabetes in their lifetime. It doesn't mean within a decade or 2 decades we can make India free from existing diabetic patient. This is not possible. So, mean to say by diabetes free India means the newborn child after 2030 or after 2040, after 1 decade or 2 decades, should not develop diabetes in their lifetime. So this is a very big goal in terms of primordial prevention of diabetes or non-communicable disease in India. So before that, how we will make this possible, I have to explain what are the challenges and burdens we are facing in India, in Asian population, as well as in the globe too. So particularly in India and in Asian population, we are facing the capital of two. We do have undernutrition, low birth weight, and undernutrition children with 5 years of age, which are very susceptible. And this is because of our genetic susceptibility, and which is non-modifiable. We cannot change our genetic and our ethnicity. So we are Asian and we are susceptible to have undernutrition and low birth weight. So it's a NILS 30 phenomena. But which are the precipitating factor to develop diabetes or other communicable disease as well? They are obesity, diet, physical inactivity, and stress, which we can modify. So our genetic susceptibility we cannot modify, and the precipitating factor of diabetes, which are obesity, diet, physical inactivity, and stress, which we can modify. This is a global heat map of the birth weight based on WHO data. We can see over here red to blue. Red means the birth weight approximately 3.5 kgs, and blue means birth weight approximately 2.5 kgs. So if you see over here, the developing country or Asian country and African country, we do have a low birth weight in terms of World Health Organization data, which suggests that Asian population and African population have a high susceptibility to having a low birth weight. This is one of my favorite slide which explain why Indian and Asian population are very prone to have and very susceptible to have non-communicable disease like diabetes. Because if we see over here the newly diagnosed type 2 diabetes, what are the features? They are have different from European countries, or we can say Caucasian population. So we, at the age of diagnosis, we do get the diabetes a decade earlier, means a 10-year earlier. If the mean age of diagnosis, mean age of diagnosis of diabetes, suppose it is 50 in the European country or Caucasian population, we do get diabetes at the age of 40, a decade earlier. And in terms of BMI, the Asian and Indian population has almost 5 BMI less compared to Caucasian population. So that means Indian population are thin and they do get diabetes. It doesn't mean you should have obesity in your genetic, but this is the thin Indian fat population. They are not that much obese to develop diabetes. For example, if Caucasian population get diabetes at the BMI 30, the Indian and the Asian population get at the age of 25. So in the male, it is 4, and in the female, it is a 6 kg per meter square less BMI for occurring of diabetes. And the mid-arm, Indian Asian population do have 20% less mid-arm, which suggests that the thin mass is less. The muscle mass is very less, 20% less than compared to Caucasian population. On the other hand, waist hip ratio is more, means 5% more compared to Caucasian population. The fat percentage, you see the tremendous, it's a 30% more fat percentage, and insulin resistance as well, 1.5 fold high in Indian and Asian population. So we called as a YY paradox. Why it is why? Because Yagnik is an Indian Pune-based endocrinology and scientist, and Yugdik, which is a European scientist, they have came out with this YY paradox. What does it suggest? If you see over here the down A, B, and C, this paragraph in the European phenotype, B means it's a lean mass, and C means it's a fat mass. So in European phenotype, they do have high quantity of lean mass, means muscle mass, and same high quantity of fat mass. So they do both the equals. But in contrast to the Indian population and Indian phenotypes, we do have very less lean mass, means muscle mass is very less, and our fat mass is very high. So central obesity is very much, visceral obesity is very high compared to European phenotype. So that's why we do get at the lower BMI, lower weight, high chances of getting diabetes or any other non-communicable disease due to our high prevalence of insulin resistance, high waist hip ratio, and high fat percentage in our body. So we can see in this picture, both are almost same BMI. We can see over here, it's a 22.3 and 22.3 BMI. Both are of the same BMI. But if we see over here in John, is Dr. John in the left of the picture, and his MRI with DEXA scan was done to measure the body fat percentage. And body fat percentage only, if we see in the left hand side, this is John, only 9.1% of body fat was there. In compared to the same BMI, 22.3, Yagnik, Dr. Yagnik was having 21.2% of body fat. So this is a genetic susceptibility and we cannot change it. That's why we get a decade earlier, and we do have a large population of diabetes, and we do have a higher prevalence and incidence of non-communicable disease as well. So this is our genetic susceptibility. This is a 30 Indian phenotype, where in the Western body and Indian body were compared. They are compared in terms of the weight, how much of distribution of weight was there in the body. So if we see in the Western baby, the fat, head, length, muscle, and abdominal viscera, almost all are balancing the weight. Whereas in the Indian baby, the fat contain almost a 30 to 35% of body weight. The head, length, muscle, and abdominal viscera equaling with the other balancing weight, but the fat percentage of even in the newly born Indian babies, they do have a higher percentage of body fat or visceral fat as well. So India today is suffering from a disease called affluenza. Affluenza, we are affected by some Western culture, and because of that, we do have increased calorie intakes in terms of the glycemic load, like calories drink are there, Coca-Cola, Pepsi. We do like pizza, burger, chips, French fries, and lots of varieties of chocolates. The second point, in terms of that, we see decrease in the physical activity. We are increasing in intaking the calories, but and in contrast, we are decreasing our activity. If we see over the left hand side, when the era was there, or were playing in playground or in the farm and eating healthy and balanced diet and doing their own work. But if in contrast, if you see in the right side, now children are playing in mobile, computer, or indoor games, and eating unhealthy substance, and not much of physical activity as well. Third point is a psychological factor. Because of developing in nature, our country, we do have a competitive in all the fit competitivity is there. So because of that, we are getting more of a psychological problem, like depression, and because of that, again, a person start eating defensive mechanism, a high calorie diet. So this we call as an influenza. This change came when the urbanization and socialization start. If we recollect in the past, when India was in terms of using cycles, when two-wheeler cycle used stop, after that two-wheeler motorcycle came. So this is the urbanization, socialization, industrialization, which lead to all this physical inactivity and the higher prevalence and incidence of diabetes. One of the main cause is physical inactivity. So within the last 2.5 to 3 decades, when people stop using cycle, but it is not bad that we do use motorcycle and the technology which make us faster in terms of our productivity. But at the end of this productivity and technology, we are losing our health, and we are increasing the disease population in our India or in nearby countries where we do have less of physical activities. We see over here the physical activity comparison between rural and urban population, and difference between male and female as well. So physical inactivity in terms of blue lines, whereas active phase and highly active phase we see in the we'll compare just rural and urban. So in the rural, yes, they do have some of good activity period in male, because they have to somehow go for a food which are being earned from some of the labor work or farming or a few of industrial work. Where in the urban population, much of table work or computer work or some of highly equipped industries. So active period is very less. Whereas in contrast to active period, the inactive period is very high. In contrast to rural male and rural male. See, rural male has a 40% of inactive period, whereas almost 2.5 fold higher in the urban male. In terms in male and female comparative, if we compare the rural female and urban female, both has very high difference in terms of inactive period. So it was ICMR in-depth collaborative study, which was done in almost 13,000 people across India. So one of the cause why this is happening, because protein are missing from children's plate, and calories diet like biscuit, bread, pastas, cheese, pizza, red meat, French fries, wafers, puris, vada pav, samosa, mendu vada, and other oily food, pastries, cake, sweets, dairy products, beverages, coffees, juice, and white sugar are they do use a lot. But if a parent want to make a children healthy, they should use lot of fruits, vegetables, homemade juice, and not the carbon packed juice. Possibly use whole grain bajras or wheat. Use less glycemic rice. Use of the sprouts are very well healthy to eat in terms of not only the children but all adults and individual as well. So, what are the negative impact of poor health? We can see in this 2010 rank, India loses the competitive edge due to a poor health infrastructure. It slips to the 55th position in the global business competitiveness index. Switzerland at the topmost, rank 1, is very healthy. Whereas if we see in the Brazil and India loses by 2 rank. If we see over here, it was 47 in 2009 and it ranked 51 in 2010, and we don't know what happened in a decade later. So, what are the prevalence in Delhi? This was a study done in the Delhi between 14 to 18 years of adolescent, and they tried to measure the prevalence of overweight and obesity in adolescent between 14 to 18 years of age. And this was done in 2 different schools, in the public schools and the government school as well. So overall, 29% prevalence in the public school and 11% in the government school. Balance was total 24% of prevalence of obesity and overweight among the adolescent. So, which is 1/4 of the total adolescent in the Delhi, we can say. And it is again going on increasing. In 2004, it was 16%, and 2006 it is 29%. And recently, ICMR in-depth study suggesting that they are exceeding 35-38%. So prevalence is again increasing. Incidence of diabetes again increasing. So why does it so? Because it changes the eating habits. And what are the current eating habits? We can see over here, the more than 40% of the children eat out once or more in a week. 70% of the children eat chips once or more times in a week. 38% of children eat burgers once or more in a week. 48, almost 50% of children eat pizzas once or more in a week. 40% eat French fries once or more in a week. 60% eats noodles and drinks Coca-Colas once or more in a week, which lead to a high calorie intake and lead to a obesity or overweight. So, for parents, the healthy children or a fatty children, the fat, they are thinking in terms of they are very healthy. So, fat children are healthy. With the age, baby fat will go away. So once he will become adult, this fat will go away. They are their parents' myths or relatives' myth. But what are the realities? Reality says that 50 to 70% of obese children will remain obese in adulthood as well. So out of 100 obese, or we can say fatty babies, 50 to 70 babies will remain fat at it is. Only 30 to 35% will become again thin or become athletic. So only chances of getting healthy is 30%. Evidence suggests that the obesity has reached alarming figures. Current figure in the news, Delhi indicated that every second person fulfills the criteria of obesity or has an excess abdominal fat. So every second we do have out of three, one person has amount of fat, or we can say criteria of obesity in his body. Second myth: what happens if a child is fat? It is nothing much to worry. He or she will not have any disease. It is just a healthy fat. It doesn't get any disease. These are the myth. But in reality, diabetes may strike early in these fatty children. Polycystic ovarian disease, excess of facial hair, and infertility may occur in these fatty girls. So the fatty girls get more kind of insulin resistance type of disease like diabetes, polycystic ovarian disease, excess facial hair, and this lead to the infertility in the adulthood. Another myth: a fat child is otherwise healthy. In the reality, almost 30% of overweight children have syndrome X or metabolic syndrome, which lead to a one step away from hypertension and two step away from type 2 diabetes. So this type of fat children can get metabolic syndrome. In future, he or she may have hypertension or diabetes or other kind of non-communicable chronic disease, which can be prevented if children get healthier in his childhood. So, what are the characteristics of obesity in India? The frank obesity, not high as in the West. So, lean mass is not that much. Only the fat mass exceeding more than 30% in Indian phenotype. Body composition and metabolism of Indians or Asians make them specially prone to adiposity, deposition of fat, and its consequences like insulin resistance in female polycystic ovarian syndrome, hirsutism, and ultimately infertility. South Asians have at least 3 to 5% higher body fat for the same BMI as compared to Caucasian. We have discussed this thing. The incidence of occurrence of diabetes less 5 percentage, or we can say a 5 BMI less in the Indian population compared to European population. The fat is typically located centrally. We call it as a central obesity. Central means waist and trunk, and around the visceral organ. So if the Indian person, if you see he is a lean and thin, it doesn't mean he doesn't have a visceral fat. If we do a MRI or a DEXA scan, we can measure this visceral fat, and which suggests that the Indian Asian population having a high amount of visceral fat, which lead to a metabolic dangerous compared to the peripheral fat. Early onset of diabetes: 10% of newly diagnosed diabetes are in the age group of 10 to 18 years. See over here, we believe that the type 2 diabetes will occur, or prevalence of diabetes is more in age of 35 or 40. But 10% of newly diagnosed type 2 diabetes are in the age of 10 to 18 years. So at the age of 12, 14, 16, and 18, children may get type 2 diabetes because of their body composition, overweight, obesity, and fat percentage. Most were asymptomatic. This is a real study picked up on the screening for obesity or a strong family history. So this was a real study which was done in South India. Second was the higher incidence of gestational diabetes in young mother with intergenerational effect. A 14% of prevalence of an impaired glucose tolerance suggests a large pool of potential diabetes. So not only the older generation, but the younger youth are getting diabetes and complications of diabetes, and young mother are becoming uh, uh, diabetes during their young age of pregnancy, which lead to further complications and consequences. So now this that was again the burden and the questions which are raised, why Indian population and Asian population has higher amount of prevalence, incidence, and population with diabetes, hypertension, and other non-communicable chronic diseases. We address all that, and now I will try to make you understand how we can prevent it, or how we can do a primordial prevention, which we learn in our PSM. So how we can eradicate this diabetes and make India free from diabetes. We have to start with the young girls, and depend on that we create a young and healthy woman, and this healthy woman give a birth to a healthy child, and we encourage healthy school kids, and these healthy school kids and children will develop as a healthy youth. And if youth will be healthy, and then only after we can be a free adult of any kind of non-communicable disease, and based on that we can make India free from diabetes. So we have to counsel young girls to eat healthy foods and become a physical active, which will increase the mass of the muscles. And they have to maintain the physical activity, monitoring for all the non-communicable disease once a year. We'll discuss this picture in detail. So how we can prevent in the womb? We have to create a healthy mother, and healthy mother will give a birth to the healthy child. Prevention at the school level, including the health science blue in curriculum. So not only the science and maths and social science and other languages should be taught in school, but they have to include a health science, how to become healthy and why it is so much of importance. They have to add this subject in the curriculum as well at the school level. And promotion of a child from one class to senior should be on the basis of health as well. So this is again a very good initiative can be taken by government to create a healthy children. Prevention in youth, promoting a healthy food of choice and exercise. We can do as a we can we call it as a blue dot in one's life. If we are having a healthy food in our lifestyle and exercise in our lifestyle, we include both of them. We including a blue dot in our life. Office culture should be standing instead of sitting. Promotion should be depend on the health. Again, which I have highlighted in the school level, the child from one class to senior class should be based on the health. Among the youth, the promotion should be depend on the health. A few of national and international multinational companies have added this point while they are promoting their employees. So again, good initiative. Prevention of complications. So once the individual become diabetic or hypertensive or any other non-communicable chronic diseases, how our goal changes toward the prevention of complications. Now he is a diseased person. We have to prevent his body from any of the complication because of that disease. So we have to improve the compliance of medication and monitoring. Like if we say about diabetes, he has to be very particular about his diet, his exercise, his medication, and although his blood sugar levels he has to measure very frequently once a year. He has to go for a full body checkup pertaining to his complications of diabetes like retinopathy, neuropathy, nephropathy, heart or brain disease. They have to screen for complications. In the womb, a young girl should be encouraged to do regular exercise at the age of not only the 20 or 25, but at the age of 5, 10, 15, young girls should be encouraged to do regular exercise and eat health food items which will help in developing their mass muscle, or we can say a lean body mass. So muscle mass will increase, the fat percentage will decrease. A healthy woman with developed mass muscle, if provided a proper diet and exercise during the pregnancy, will deliver a healthy child. So the first problem was that we are having a genetic susceptibility toward the low birth weight and undernutrition. So if we create a healthy mother and develop muscle mass, and if she is given a proper diet and exercise during pregnancy, we can decrease low birth weight and undernutrition children as well. In the school level, health science should become part of the curriculum, as I discussed. All the schools should be encouraged to provide a healthy food for the children from school canteen. Like we discussed Madhyahan Bhojan, they have included this healthy food and healthy habits in their Madhyahan Bhojan program. So lots of, I think, lakhs of government children are getting a benefit from this Madhyahan Bhojan. Outdoor sports and exercise should be encouraged in students. Nowadays, all children are very much busy in their mobiles or laptops or tablets, and most of indoor games are playing all the times, because in the urban, if you see in the metro cities, very less playgrounds are there in the cities. Not much of garden to play and go for outdoor activities. Lots of crime are happening in all over the cities and metro cities particularly. So parents are afraid to send their children alone for play in gardens or in some sports activity. So these are the concern pertaining to outdoor sports and exercise. Prevention in youth, according to WHO survey in 2030, 1 out of 3% about the age of 30 will suffering from any of non-communicable disease like diabetes, hypertension, thyroid, cholesterol, metabolic syndrome, any of non-communicable disease. If you think of, it is very important for any country to prevent youth from developing such non-communicable disease at very early age, as it will impact overall productivity of the country as well as quality of life also get spoiled. That's why I discussed earlier point, the negative impact in the competitive index ratio, where India slipped from 49th rank to 51st rank. To prevent diabetes in young people should be encouraged more and more to use a public mode of transport instead of going alone with a bike or four-wheel. Use public transport, which will help to do some physical activity. You have to catch up public transport, you have to walk or you have to run. Maybe if you are unfortunate, avoid unhealthy food items like we discussed, cold drinks or pizza, burger, samosa, vada pav. To do regular exercise, at least 30 to 45 minutes a week or 5 days a week should be encouraged in young people to get rid of or to prevent this non-communicable disease occurrence. Prevention of complications. If diabetes is managed effectively, its complication can be prevented or at least can be delayed. Effective management of diabetes is dependent on treatment compliance, monitoring, and self-education. How we can prevent it? A population-based strategy and high-risk strategy. So population-based strategy means we just educate and aware all the person in population. Means if we are going for educating or awareness program in one village, we have to educate whole and soul village or a city. So we have to increase the awareness about diabetes and its complication in the mass by all the form of media. What are the high risk strategy? So involve the individual at a high risk according to the Indian diabetes risk score in the prevention of activity. If you find family history and genetic susceptibility or obesity patient, he or she has one of the non-communicable disease, he might get other as well. So they are the high risk population, and we have to get a strategy to prevent any other complications or occurrence of any other non-communicable disease, and we have to get uh, some program for them as well. So who all can join in this mass program to make India diabetes free? So all the types of media, whatever you are using, and whatever the print media or social media or any other kind of medias are there, we should continuously promote healthy lifestyle, healthy eating, and physical activity as well. Government, they should come out with more of easily available public transport, more of playing grounds, areas, and make some healthy science must in the curriculum of at the school level. Hospital, they should not only focus on getting a disease patient, but each and every time a disease patient come with non-communicable disease, a hospital staff or a hospital administrative person or a doctor should encourage a relative who have or attendant who have came with the particular disease person about lifestyle, getting healthy, doing activity, and what are the benefit of the young healthy childrens, and this what we discussed at the each and every hospital staff, and each and every hospital should encourage this thing at the school and college level. So one standard to another standard, not only the based on the mark sheet, but also the health habits, and the healthier children should promote for the higher classes. And depending on that, in college level also some election, if we in point of election, who will get nominated for the or who will get ticket for JS or something like the election. So healthier person will get ticket, something like that we can create, or government create in the colleges. Doctors, yes, particularly with doctors who come in direct ill person or diseased person. So they will treat them, they will prevent the complications of that particular disease. Not only that, they have to counsel the relative and their offspring as well, and teach them and encourage them, educate them, aware them about this non-communicable disease prevention. Industrialist, like they have to create a standing, or they have to create some kind of encourage the physical activity types of things. I do have I was working in industry as well, so we have created a program where all the employees can have a half hour break for their gym. So 8 hours duty, half hour you can spend on your physical inactivity, physical activity. Like you can do some treadmill, and you can do some physical activity in that 30 minutes. In the big industry, where you have to go by one end of to another end, you have to go by a car or a scooter. There you can put some cycles. So. Which include physical activity for that employee. If the employees are healthy, the company will be healthier. and the nation will grow up. Celebrities, other than promoting Coca-Cola and Thumbs Up and the things, they should promote healthier lifestyle. NGOs, yes, most of NGOs are doing good in terms of prevention of non-communicable disease. They should also join hand in this movement. So, by all this mean, we have to do a primordial prevention for non-communicable disease like diabetes, hypertension, thyroid, cholesterol, and we can prevent the consequences of this non-communicable disease as well. And we can create a healthy nation. That nation can compete all over the globe and become a developed country. I think that's all from my side. Thank you, all of you. Thank you so much for sparing your time.
Okay, Dr. Deepak. Yeah, so thank you so much for your valuable presentation. Okay, and so you explained each and everything. Okay, in country-wise and globally wise also. Once again, and thank you. And right now, this section is open for the discussion. Okay, so let's wait for that.
I hope it was informative and maybe we can use in our day-to-day activity as well.
Yeah, exactly.
Good afternoon, sir.
Good afternoon.
I'm Umama Solanki. And first of all, thank you for a wonderful session on diabetes. I would like to ask that is there a link between irregular meal patterns and high diabetes?
So, as my topic was to prevention of diabetes, but a patient get diabetes and he or she has a irregular diet pattern, yes, it will hamper his diabetes control because he or she will get fluctuation in diabetes. Might be if he has a delayed meal, he get hypoglycemia as well, and because of hypoglycemia, he will have a defensive eating. So if he or she daily eating only 2 chapatis, if he has late meal and he get hypoglycemia, he will eat 4 or 5 chapatis. So again, hypoglycemia, then he has a defensive eating, and she will become postprandial hyperglycemia. So after eating, his or individual sugar will go high, and because of that high sugar, again doctor will change the medication. You see. So it's a circular motion. Hypoglycemia, defensive eating, hyperglycemia, it will increase the medication. And again, this medication, if patient or delays the meal or irregular in their meal, it will again have depression and diabetes. Am I audible?
Yes,
Yes.
sir. Thank you. And even I have one more question. Like, what is most important to control diabetes? Like treatment, food, or following of design lifestyle? Is it really possible to follow all of them? And if yes, then how?
So it's not like the possibility. It's a possible and it's very easy. So there is no question about the possibility because if you go to a very specialized diabetologist, he will explain you in very simple way how to control diabetes. So I say my patient that there should be 3 pillars in treatment of diabetes. One, you should control your diabetes with diet. Second, with physical activity, and third, with regular with your medications. So these are the 3 pillars in treatment of diabetes, and it's very easy. You just in terms of this food habits, you should know this diabetes is because of your high amount of carbohydrate in your food. If you reduce your carbohydrate, your 30 to 35% of glucose control will be there. But patients are not that much educated or aware which type of food has a higher amount of carbohydrate. Some myths are that jaggery can be eaten and sugar cannot be eaten, taken in the food. But if we see, jaggery and sugar are both from a sugar cane. So there is no much of difference in terms of carbohydrate load and glycemic index as well. So this both should be avoidable. And as well as गुजरात में प्रसाद की प्रथा है, प्रसाद में
Yes.
होता है,
Yes, sir.
we call it as साकर.
Yes.
Yes, तो साकर पण अगेन शुगर केन से ही बनती है. So that much of awareness is not there. And diabetic patient, they always look for easy way to go have some kind of sweet. So they think, yes, jaggery is good, sugar can be avoided. And in terms of honey, some myths are there. Honey can be eaten by diabetic patient. Again, in the honey, 70 to 70% of glucose are there, means carbohydrate are there. So diabetic patients should avoid honey as well. If I say in terms of cereals like wheat, bajra, jawar, makai, and rice, we all know that all these cereals contains almost an equal amount of carbohydrate. So glycemic index and glycemic load can be different, but ultimately they are equal in the terms of carbohydrate. So another myth is there, bajra can be eaten by a diabetic patient because bajra doesn't contain carbohydrate, much of sugar. But in contrast, wheat, bajra and rice have equal portions of glycemic load. So not only the bajra, but wheat, bajra and rice, three of them can be consumed by diabetic person, but the portion should be restricted. So which can be planned by your diabetologist or dietitian, how much amount of these cereals like bajra, wheat and rice you can go with in your diet. You use of much of salads, then pulses in your diet. You can have a buttermilk to replace your carbohydrate intake, and you can go ahead with exercise. American Diabetes Association suggests that at least 30 to 45 minute brisk walking 5 days a week is sufficient for diabetic patient to get control over his or her diabetes. So diet, exercise, combined lifestyle modification, and you take regular medications, whatever given by your physician, clinician or diabetologist, you can get very good control of it. And ultimately the aim of diabetes control is to prevent complication like eye disease, heart disease, severe stroke, neuropathy, gangrene. So you can decrease the prevalence of this complication, or you can delay the complication, which means patient getting average 10 years after 10 years of diabetes, he or she should get after 15, 20 or 25 years. So this remaining healthier year can be a productive year for their life.
And Dr. Deepak, I have to ask you a little bit. First, congrats for presenting nice topic and nice presentation. I'm happy to see you here. My question is, what is the role of determination if an individual is well determined that whatever doctor says, not to follow the advice? Whatever is good for our life, we have been talking about lifestyle, but somebody is firm not to follow those lifestyles, right? So in such scenario, which is being seen nowadays, and biological cycle has also changed over a period of time because of this electronic system, work from home, right? So what to do in this type of situation?
Yes, sir. Very good question again, because determination, D for determination and D for discipline in diabetes. So if we follow this 3D, and we can get rid of complications as well. So regarding determination, I want to add the thing is reversal of diabetes. What is the reversal of diabetes? If patient is determined by his lifestyle modification, means diet and exercise, he can get rid of diabetes. So he or she may not have to take diabetic medication if he is determined about what diabetologist says or what dietitians say pertaining to their diet and exercise. And if he is obese and loses the weight, he can be free from diabetes. So this much of impact is there in the determination when you are treating diabetes. So we are getting almost 20 to 30% of person, they are totally not following your advice. Whatever you suggest, they will not do it. They will say, yes, sir, you are right. And after the 3 month of average, you see there won't be any changes in HbA1c. So but as a clinician, it's my duty each and every time. I cannot just let him go without saying anything. Each and every time I have to spare 5 more minutes to explain. Each day, I hope each day or next day, he will be a new person, and I hope he will understand his diabetes, and maybe I can prevent his body from any kind of complication. So this is my personal duty. I cannot just give up on a patient as a diabetologist, because this is the lifestyle disease. It is not such kind of malaria or dengue and you treat for 5 days, 7 days and it will go away. No. If you are practicing as a diabetologist, your mindset should be there. Each and every patient is following or not following. You have to each and every time you have to give them education. You have to explain them, and particularly unfortunately, you have to spare more time on the patient who are not following you. So this is the thing.
Yeah, biological cycle which people have changed nowadays.
Sir, biology is pertaining to
late hours sleeping, late night eating.
Yes, sir. I'm coming into it, because the change in the biological cycle, our hormone secretion cycle is also changed. So stress hormone and ecstasy hormone, if you do daily early morning walk, your ecstasy hormone are getting well secreted, and it keeps you what you say. It keeps you going on, and you all day you feel well and enthusiastic. In terms of you getting late from the bed, not in the early morning or around 9-10, your biological cycle is changed, and it leads to a hormonal stress in your body. So one of the cause of insulin resistance is the inflammation, which was created due to these stress hormones. So because of change in the biological cycle, you are inflamming your body because of this stress hormones, and you are getting more prone to have insulin resistance, and insulin resistance getting you this diabetes and other chronic disease as well.
Thank you very much. Happy to
Dr. Deepak.
Yeah, Shashwat, please go ahead.
Yes, I'm Dr. Shashwat, professor in the Department of Community Medicine, and I had a couple of questions for you.
Yes, sir.
Yeah, first of all, congratulations for a good presentation.
Thank you.
Yeah. So my first question is that as we know that most of the utilization of the diabetes services is from the private sector, right? So people normally go to a nursing home or a private hospital to seek the healthcare services for treatment and screening of diabetes. And therefore, most of the healthcare services or non-communicable disease services which are provided at the government sector remain unutilized. So my first question is, how do we improve this scenario where the utilization of the government sector improves? That's the first point. And secondly, there is a new wave, I will say, or a new trend of practice of intermittent fasting, which prevents hyperinsulinemia. So what is the mechanism and how does it actually prevents hyperinsulinemia? Because the classical thought is always that a diabetic should have multiple meals which should be spread over a duration of 24 hours rather than fasting for longer duration of time. So can you throw some light on this?
First of all, we'll speak about this unutilized government services. NCD cells, you might have heard, non-communicable disease cells. Each and every primary, each and every district, and each and every taluka level hospital has this non-communicable cell. NCD cell, we call it an NCD cell, and government has appointed a totally new doctor. We can say not the primary health care physician who are taking care of PHC, CHC. Other than that, they have recruited other doctor, MBBS doctor for NCD cells. Only thing is that two things. One is the doctor is not much trained. They are all MBBS doctor, and much of MBBS doctor are not trained in terms of treatment or managing diabetic patient. They don't know much of the basic about disease. They don't know much of lifestyle modification, how you can counsel, how you can educate patient, and how you treat, again, a questionable because the limitation pertaining to diabetes medication, diabetes screening. Two example I will give you. Only 3 to 4 types of OADs are there in the government supplies. So we do have metformin, insulfonylurea. I think glipizide is there. There are no pioglitazone, no DPP-4 inhibitor, other than some tertiary level care government supplies. They do have some DPP-4. So lack of molecular in treatment of diabetes and lack of screening, like only in NCD cells, they do have glucometer to treat diabetes, which is not sufficient. Every 3 months they have to check, go for HbA1c as well. Every year they have to screen for complications like creatinine, thyroid, cholesterol, and early complication to measure every risk factors like urine ACR is there, microalbuminuria, retinopathy is there, neuropathy screening like monofilament are there. So these are the basic facilities are not there in NCD cells. And much of trained person are not that, doctor are not that. Because of that, all the population are diverted from government to private sector. Second, as you said, sir, the intermittent fasting things. So these are actually designed for what you can non-complicated diabetes patient or obese, overweight diabetes patient who has a higher risk of developing diabetes. When they do intermittent fasting, means 10 to 12 hours they don't eat anything, and after that they can eat a portion of food in their amount. So when we are prescribing this intermittent diet program, we just modified their moleculars, because some before that, I'll come to the topic that why we are saying each and every diabetes patient should follow frequent meal. They should eat regularly. They should not delay their meal, because some of the diabetic medication are hypoglycemic medication. So once you patient take that medication, they will start acting. Whatever the amount of glucose will be there, if it is 400, 300, 200, 150, 100, 80, even up to 80, it will go on working and working. So if patient doesn't follow a given diet pattern, he might go into hypoglycemia. So this hypoglycemic agent, when doctor prescribed to that patient, they advise them to not to delay the medication and follow frequent medication. In terms of intermittent fasting, when person doing intermittent fasting, actually they are increasing sensitivity insulin resistance, and because of this improving in insulin resistance, they are getting good result in terms of diabetes control. So whenever we prescribe intermittent fasting, means this diet plan, we adjust the drug, we add the drug when they are starting fasting. We include the drug which does not produce hypoglycemia. And if we have to give any kind of hypoglycemic drug, we give them when they are starting feasting, or they have to take some kind of food, and it should be a short acting. It should not be a long acting, means it should not act for 24 hours. We are giving medication which acts only by 6 or 7 hours. So because of that, we prevent hypoglycemia. And this intermittent fasting, again, few of papers are there in national and internationally. They improve insulin resistance by increasing adiponectin, reducing the inflammatory markers. So this is the two main mechanism where we can see a good result not in terms of diabetes, but weight loss as well. So when you are reducing the weight, again, it will help to improve insulin resistance, diabetes, and inflammation as well in the body.
Okay, thank you for your response.
So.
Hello. Okay. Thank you, Dr. Deepak. Okay.
Yes.
So I hope so. It was so informative and very interesting for me, not only for the entire section, but so you explained in a systematic way where everyone can understood very easily, and also the importance of the diabetics. Okay. So your vision is the diabetes. No,
Yes.
Free from diabetes in India. Okay, so join together. Okay, we also participate in this is a long vision. Okay, so coming future it will definitely come down its incidence and the prevalence rate. Okay, so once again, all the participated, and once again, thank you, Dr. Deepak. Okay, thank you so much. So right now this program is concluded. Okay, thank you so much.
Thank you, all of you.
Yeah, thank you so much.
There is power failure, sir?
No, it's a laptop, sir.
Your laptop, but